Medical news from European Heart Journal. Proprotein convertase subtilisin/kexin type 9 inhibitors, past, present, and future. Proprotein convertase subtilisin/kexin type 9, PCSK9, inhibitors have emerged as a potent, LDL cholesterol-lowering therapy that can be added to high-intensity statins, delivering reductions in low-density lipoprotein, LDL, to roughly 1 mmol per liter, almost equals 40 mg/dl, and translating into measurable cardiovascular benefit. Across multiple large outcome trials, monoclonal antibody PCSK9 inhibitors consistently cut the incidence of major adverse cardiovascular events, MACE, by about 15% relative to standard care, confirming that intensive LDL lowering beyond what statins achieve is both feasible and clinically valuable. Cardiovascular disease remains the leading cause of death worldwide, and residual risk persists even after patients achieve guideline-directed LDL targets with statins and ezetimibe. Genetic studies that linked loss-of-function PCSK9 variants to markedly lower LDL and reduced coronary events provided the mechanistic rationale for pharmacologic inhibition. But prior to the advent of PCSK9 antibodies, clinicians lacked a safe, effective means to exploit this pathway. The need for robust evidence of outcome benefit, especially in patients with established atherosclerotic cardiovascular disease, ASCVD, those with subclinical atherosclerosis, and individuals with diabetes, drove the design of several pivotal Phase 3 trials. The most influential studies were the Fourier trial, evolocumab, and Odyssey outcomes, alirocumab, both double-blind, placebo-controlled, multicenter investigations enrolling over 27,000 patients with recent acute coronary syndrome or chronic ASCVD. Participants received background high-intensity statin therapy, and PCSK9 inhibition was administered subcutaneously, 140 mg monthly for evolocumab, 150 mg biweekly for alirocumab. LDL cholesterol fell from a mean baseline of 2.3 millimoles per liter to 0.9 millimoles per liter, almost equals 35 mg/dl, in the active arms, a reduction of roughly 60%. In Fourier, the primary composite endpoint of cardiovascular death, myocardial infarction, stroke, hospitalization for unstable angina, or coronary revascularization occurred in 9.8% of the evolocumab group versus 11.3% of placebo, hazard ratio 0.85, 95% CI 0.78 to 0.93, p less than 0.001. Odyssey outcomes reported a 15% relative risk reduction for the same composite, hazard ratio 0.85, 95% CI 0.78 to 0.93, p equals 0.001, with absolute event reductions of 1.5% over a median follow-up of 2.8 years. Both trials demonstrated consistent benefit across pre-specified subgroups, including patients with baseline LDL greater than or equal to 2 millimoles per liter, those with diabetes, and individuals with prior myocardial infarction. Additional large registries such as OSLER-1 and OSLER-2 reinforced these findings, showing a 20% relative reduction in MACE and a favorable safety profile, with injection site reactions and neurocognitive events occurring at rates comparable to placebo. Secondary analyses highlighted that the magnitude of cardiovascular risk reduction correlated with the absolute LDL decrement, supporting a lower is better paradigm. In patients with diabetes, PCSK9 inhibition lowered LDL to the same target levels without increasing glycemic indices, alleviating concerns about metabolic side effects. Moreover, exploratory imaging substudies demonstrated slowed progression of coronary plaque volume, suggesting a mechanistic link between LDL lowering and plaque stabilization. The cumulative evidence positions PCSK9 monoclonal antibodies as a class effect therapy that should be considered for patients who remain at high residual risk despite maximally tolerated statins, particularly those with recent acute coronary syndromes, multivessel disease, or familial hypercholesterolemia. Guideline committees have begun to endorse PCSK9 inhibitors as a Level A recommendation for secondary prevention when LDL targets below 1.4 millimoles per liter cannot be achieved with conventional therapy, and as a reasonable option for primary. Thank you for watching. For the full article, visit MedMind AI at medmind.pro. Like and subscribe for more evidence-based medical content.